Hi, I'm Valeria from the Dundee Career Centre, and today I'm with Nicola from Dundee Volunteer and Voluntary Action, and we're going to be talking about older people services. So, if you want to just introduce yourself a bit, Nicola.
Okay, so yeah, I'm Nicola Mitchell. I'm the Older People Services Development Officer with Dundee Volunteer and Voluntary Action. And my role is to support and promote the active involvement of older people in the planning, development, delivery of services. And that's services across third sector and statutory, which reflect the views of older people in Dundee. And the older age limit that I work with is 50 plus, and that's the whole city.
Awesome. So, we have a couple of questions that we want to ask you. So, the first one is, are there any plans in place to help ease older carers or older people out of lockdown?
Yeah, we've been doing an awful lot of work over the lockdown period to make sure that older adults in Dundee have been supported. We're really conscious that lots of people attend meetings and groups and activities, and with lockdown, they've not been able to do that. So they've been maybe more isolated than they would be in normal circumstances. So to ease people out of lockdown, we've put together, I've been working very closely with the Hope Project, that's helping older people engage, the Grey Lodge settlement, and volunteers that we recruited through our Get Local support project. And some of the things that we've put in place have included everyday packs. So again, we're worried about when lockdowns coming to an end for people, we're worried about the folk that have been shielding this entire time and now are finding that if they go to a shop, then obviously wearing a mask is mandatory. So they've not had the opportunity and they maybe don't have anybody to give them a mask or to give them the supplies. So our everyday packs include a reusable washable mask and a hand sanitizer. So we've put that out to the network to identify people who maybe are in that situation, and actually just receiving this will make them feel a little bit safer, that when they're ready to then go out the house, whether that's to go to the shops or to go for a walk and meet their friend, then they've at least got the protection that they need to do that. We're currently also looking at exemption letters. We're obviously aware that masks are mandatory, providing you don't have a health condition where a mask would cause you pain, severe distress, or anxiety, or if you need medication, or if you need to communicate with others who rely on lip reading. So having a health condition doesn't make you exempt in that sense, as if it causes you severe distress or anxiety, which then causes you to have difficulties breathing. So we're working with Dundee City Council to put together effectively a letter. So people can contact Dundee City Council customer services, give them your name and address details, and they'll send out a letter that's a little bit discreet. So if you're going into a shop and you feel like people are looking at you, or the shopkeeper is saying, no, you're not getting in because you don't wear a mask, you can show them this letter that just says, actually, I have an exemption and I'm doing this really nicely and really quietly because I don't want to cause a fuss. And we hope that that'll make people feel a little bit less anxious and a little bit less stressed out about it. Also put together some have a go activity packs, which have gone out to 90 older people in Dundee, and a whole host of hampers then that have gone to shelter complexes and other groups that have identified people. And they've included things like, it's a bit of a three-pronged attack. So the first pack went out the end of June there, and included things like jigsaws and crosswords and just some activity pieces, just to kind of keep them ticking over and keep them a bit more thinking about their mindfulness and their mental health. The second one is going to include a Move It or Lose It DVD. So that's about strengthening your bones and strengthening your ankles, and some easy exercises that you can do while sitting in your chair, whether that's just lifting your heels off the ground as you're sitting, just to get a little bit of strength in you. Because again, we're concerned that for everybody that's maybe not got good mobility and they've been stuck in the house for such a long period of time, and maybe just moving between the kitchens, put the kettle on and back to their settee again, then their strength's obviously going to be reduced. So we are concerned again that when people do start to go out, that their bones, they're not going to be quite as agile, and then they're going to be at risk of slip, strips and falls. And we don't want them then back in the system for that, for falls related injuries. So the third pack then is going to then be a little bit, because we've got them to build up their strength, the third pack's going to have information about the different services that are starting to reopen, and what their new operating hours and times might be like, or what their new services are going to be like. Obviously, we don't know when we're going to be out of this completely, so we don't know when community groups and social activities are going to be allowed to resume again. So we're just having to think really differently about how we can support the people who would normally go to all of these different things, and in order them to kind of to still go out and to still speak to people and to still, try and do as much as they would like to be able to do, so that when the time comes that they are able to go back to a social activity, they're ready to go. The other thing that might help people when they ease out of lockdown is, again, if they're going to be using public transport, the Thistle Assistance Card is a Scottish-wide travel card, effectively, and it just gives you a little bit of assistance. So again, it's about showing the driver something discreet that says, I need a little bit more support. Whether that's that he needs to speak clearer to you, or whether he needs to wait until you're in your seat, or he needs to tell you where your stop is, or anything like that. So you show this little card at the same time as showing your bus pass potentially when you're getting on, and it gives you that bit of assistance. So they've updated that to say, I'm exempt from wearing a face mask because of a health condition or a disability. So again, we encourage anybody that needs that extra support, or potentially that will be exempt using public transport, to get yourself a Thistle Assistance Card. So you can phone the Dial-Up helpline for that, and we'll get a referral in for you.
Awesome, thank you. Our next question is, what can older carers or older people do to help tackle isolation during COVID-19?
Yeah, it's obviously been incredibly difficult, but I guess what we would say is that we would encourage people to make contact with services. If you have any questions at all, I've mentioned the Dial-Up helpline. It's our telephone helpline, and it's for adults of any age. So you don't need to be an older person at all. It's effectively your very own Google, but while speaking to a real person at the other end of the phone. So yeah, we would encourage you to make contact with services such as Dial-Up, and again the Hope Project, and they can then signpost you onto the different services that are out there, and the different providers that have been operating during lockdown. So again, if that's that you needed a food parcel, or you would like an everyday pack, or you need an exemption letter, or actually the activity packs, anything like that, of all the different services, that we've put into place, these guys are able to take the referrals in and forward you on in the right direction. So yeah, make contact. Don't sit and worry about it, I suppose.
And so the third question is something you've already mostly spoken about, but if there's anything else, what services are available to older people right now? For example, shopping, support, prescriptions?
Actually quite a lot, and I've had to write down a little list because my memory is not quite as good as it was when we started lockdown. So in addition to the things I mentioned earlier, we're doing a book and jigsaw service. So again, whilst the libraries have been closed, we've been using volunteers from our Get Local Support project, and they've been delivering books and jigsaws to older people. So it's been books and jigsaws that have been donated, and people phone us and tell us that they like, they might be like autobiographies, or they like sports books and they don't want any romance books, that type of thing. And I send a list to the Hope Project, and the Hope, Maureen at Hope speaks to Grey Lodge Settlement, who have been storing an awful lot of these different packs for us. They've had the storage, which has been fab. And somebody picks a selection of books and jigsaws, and then a volunteer goes and collects it, delivers it straight to the person's door, delivers it contactlessly, of course, and that's been fab. And then when people are finished with the books and jigsaws, they give us a phone and we'll come back and collect it. So that's been working really well, because again, lots of people didn't have the means. Lockdown happened so quickly, they didn't have the time to be able to go to the library and stock up. So that's one thing. Prescription service and shopping option. We've been doing a shopping by invoice option for people. So again, using the Get Local Support volunteers, we were quite conscious as well that people again had maybe taken out enough money out of the bank to last them maybe 3 weeks. And that 3 weeks came and went fairly quickly. And then folk were panicking. So if they were having to rely on other people to go for their shopping for them, they maybe didn't have cash at home. We obviously don't want to be giving out cash to people that we don't really know, even if it's a neighbour. So we had this other option, or this other idea, that if we could arrange a shopping by invoice option, a volunteer could go with a shopping card that we've already prepaid, and then we'll send the invoice afterwards. We don't have any plans to stop that service at this moment in time. So again, if that's something that you think, actually, that's really useful to me because I'm still not happy or comfortable in going into shops myself yet, there's an option for you. And the same with collecting prescriptions. Phone dial up and we'll arrange for a volunteer to collect your prescription for you and deliver it to you. Connecting Scotland is a project that we're currently looking at. So we've applied for funding to Scottish Government for digital champions. Again, we've been really aware that lots of people don't want to be online, and that's completely fine. There's lots of people who might like to be online, and it might be due to a lack of computer skills, or they just don't have the finances themselves to be able to purchase a device and would normally use the services of the library, but maybe have family who live down south or just in another part of Scotland, and having a device would have made that really easier for them. So Scottish Government have made some funding available called Digital Champions. So we've applied for this. So what we will need to do is establish for people in Dundee, why do they not get online? What's the reasons for that? Because we do expect that there might be a second wave of this funding as well. So if we're unsuccessful in this round, it would be really good to be able to identify, or to be able to say, in Dundee, this is the situation. So we will be issuing a survey in the next couple of weeks for that. So I will share that with the Carer Centre, and that would be great if you could share that on with your folks. We've also been delivering, although it's due to come to an end in the next couple of weeks, an under-nutrition project. So it's been called Come Dine With Us. So we operate this in the St Mary's area of Dundee currently. And it normally would be that every Wednesday or every second Wednesday, you would get picked up, taken along to the St Mary's Community Centre, and you'd be given your dinner, effectively. So it's a dinner club. Instead of a lunch club, it's a dinner club. That service obviously wasn't able to continue with people going for their dinner, so we started delivering meals to people's doors. And then again, due to some funding that we got from the big lottery, supporting communities, we were able to roll this out across Dundee. So we've been delivering meals to 30 older people for the past, so for 10 weeks, so we've got another 2 weeks left. And that's for people who have, whether it's been a poor mood or just a lack of general motivation, their families aren't able to deliver food to them anymore, or they've maybe just been surviving on tea and toast, which is not great, and they're at risk of undernutrition. We've been delivering this programme to them. Now, obviously, this is going to come to an end, but we're working with individuals to then identify, actually, if they were at risk of undernutrition during lockdown, are they still at risk of undernutrition now? And if so, we need to divert them to the meal service or to other meals options to come to them. Get Active at Home is the other thing that we're working on currently. So that's with our Green Health partnership team, Green Health Prescriptions, and we're putting together some virtual activities. So again, thinking about people's strength and keeping them active and mobile for when they are ready to go out back to their normal social groups. This is obviously for people who are online, and we're putting together some easy, saying easy, beginners is maybe better. Beginners yoga classes, beginners Pilates, beginners kind of chair exercises, gentle exercises. 5 classes a week, and it's going to run for 14 weeks. So again, about helping people to stay active indoors, but also to allow them to connect up with others. It's really nice just being able to see your face today. So for an awful lot of people, they might have had the online means to be able to find an online class, but not knowing the instructor and not knowing actually whether that class is suitable for their ability levels or not, or they might have a bit of a sore hip at the best of times, and to be able to say to that instructor before they start the class, is this suitable for me? You can't necessarily do that with just a pre-recorded online class that you found on YouTube. So this was about it being at a level that's suitable for you. You get the opportunity to speak to the instructor, and then obviously you get used to seeing the same faces week on, week out. So when it comes to the end of the 14 weeks, although it's probably going to be about October by that point, so that's maybe not great to then be starting to go for outside activities. If we can find a location that can allow us to do an inside activity that's large enough where we can all socially distance, then that would be certainly the plan. So we're hoping then that through doing that, again, they're reducing their social isolation and forming new friendships and social groups at the end of it. And then obviously we started the pensioners priority shopping hour, which was the kind of first hour of the shopping day with lots of the supermarkets. And I'm pleased to say that that doesn't look like that's going to stop. It looks like that's going to continue on. So again, that's great. If that it helps to alleviate carers' stress or older people's stress about going into busy supermarkets when there's lots of other people, then if that makes it easier for them, then I'm happy, really. So yeah, that's quite a lot, I think, but possibly just a whistle-stop tour of some of the things that we've been doing to try and alleviate social isolation and some of the stresses and pressures that older folk and older carers have been having. So yeah.
Yeah, no, that's a lot. It's really good to hear. I really hope people do take advantage of that. But yeah, it was really, really lovely to catch up with you. Thank you very much.
I was just going to say that without the funding from Big Lottery Supporting Communities Fund, and without the support of other partners from the Older Persons Network, in particular the Hope Project, and as I said, the Grey Lodge Settlement, and the volunteers from the new Get Local Support volunteering project, which is, again, it's informal volunteering. So we very much hope that we were inundated with people wanting to volunteer, and whilst lots of them have gone back to work, we really hope that that's going to continue in some informal manner. So yeah, without them, we wouldn't have been able to put any of this in place. So I really need to just extend my thanks to them.
Thank you very much.
Thank you.